Our top story this hour, the Wuhan coronavirus. New cases have been reported in the region and governments have tightened screening measures to contain the outbreak as the Chinese New Year travel rush peaks. South Korea has ordered full preemptive quarantine measures and Singapore will form a ministerial task force to deal with the Wuhan virus. Chinese health officials warn the new coronavirus could still mutate and spread. And at a briefing held by the National Health Commission in Beijing, officials revealed that there are now over 400 cases in the country, with the death toll climbing to 9.
Meantime, Changi Airport here in Singapore has rolled out temperature screening for all flights arriving from China, as advised by the Health Ministry. Some 35 scanners were put up across all 4 terminals from noon today, and that's among stepped-up precautions taken by the travel industry. Gwyneth Cho tells us more.
Passengers of this flight from Hangzhou went through temperature scanning upon landing. The airport has been screening travellers from Wuhan since 3rd January and expanded this to all flights from China as the number of cases reported across the mainland rises by the day. The airport says there are some 430 flights from China every week. The Health Ministry says those with high temperatures will be evaluated by a doctor at the airport and sent to a hospital by a dedicated ambulance if needed. Travellers coming off of flights from China will also be given a copy of this health advisory in both English and Mandarin. Now, issued by the Health Ministry, it asks travellers to visit a doctor soon if they experience fever and shortness of breath and were in Wuhan in the past 2 weeks. Now, we've also observed that many travellers have taken to wearing face masks in the transit area as a precaution. As Chinese New Year approaches, travel from China will also rise. Data from the Singapore Tourism Board over the past decade shows travel from China surges during the month of the Chinese New Year. In anticipation, hotels in Singapore are also taking precautions to protect staff and guests. Royal Plaza on Scots says guests from China make up 15% during the Chinese New Year period, compared to 3% at other times of the year. Staff started compulsory temperature taking recently, with extra precautions for those returning from China. The hotel has also stocked 500 face masks.
And in case there is really a case of a virus in the hotel, we'll quarantine the room, we'll lock the room, and will not let anyone go back into the room to make sure it's not spreading. And the people who have been in contact with the guests or people will be sent to the doctor as well, to the hospital.
Millennium Hotels and Resorts, which includes Orchard Hotel in its portfolio, says guests and staff are required to declare their recent travel history and illnesses. Shangri-La Hotel's precautions include more frequent cleaning and sanitizing of its premises and enhancements in food procurement and handling. The hotel says staff are also reminded to practice good hygiene.
Now, as we mentioned earlier, Hong Kong officials have just briefed the media about a highly suspected case of the coronavirus in the city. And for more, our correspondent, Afifa Arifin, joins us from Hong Kong. Afifa, tell us more about the details on this particular case.
Well, indeed, the Hong Kong authorities have not confirmed any cases. In fact, the Health Secretary, Sophia Chan, said that there is just a highly suspected case of a person who had been infected with this new strain of this coronavirus that came from Wuhan. Now, she revealed more details in saying that the highly suspected person is a 39-year-old man who is a Wuhan resident. Now, he and his family arrived in Hong Kong on Tuesday evening by the high-speed rail from Shenzhen. And upon arriving in the city, they had spent the night. He and 4 of his other family members had spent the night in a hotel in Kowloon. Now, he was immediately taken into observation because he had displayed symptoms such as a fever and a blocked nose. And he is currently in the Infectious Diseases Center at Princess Margaret Hospital, where more checks are being done. And the authorities say that they hope to conclude those tests to reveal whether he does have the virus or not by tomorrow. Now, the 4 other family members had not displayed any symptoms related to the virus, and they were allowed to leave the city. I understand that they had departed to Manila. Now, the Department of Health had said that those who had come into contact with this patient, especially those who were on the train, will need to be put under medical surveillance, but those who were not on the train did not need to worry at this point in time.
FIFA, memory is still fresh about the 2003 SARS outbreak, and Hong Kong authorities have dealt with that as well. Nearly 300 people died then. What kind of preparations are they taking this time round to curb the spread of this new virus?
Well, immediately as soon as, this highly suspected case came out, we do know that the West Kowloon Railway terminus, where the man arrived from, has been completely disinfected, especially the areas that he had walked around. The train that he was on has been sent back to the mainland, and the authorities in Shenzhen have also been alerted. The authorities also say that the hotel that the man had stayed at with his family has been alerted to this case, and they had infected the entire floor that the man had stayed at. At present, the Hong Kong health authorities are saying that there are enough preventive measures put in place, and this includes temperature screenings at every exit and entry point into the city. And there are also health declaration forms where people coming in from the Hubei province need to fill up. They say at this point in time they need to consider the scale of the outbreak, and will need to review the protocols from time to time. But by and large, there are also a lot of other measures being taken by other aspects of society, including schools, for example. They are stepping up more preventive measures, especially as we go into the long Chinese New Year holiday period, when many families would travel out of the city, especially into mainland China. So schools would require that some of their students go through mandatory temperature testing, as well as having their hands sanitized as well. But, by and large, we are seeing that a lot of people in Hong Kong, reminded by that SARS crisis, are taking a lot of personal responsibility on their health. We are noticeably seeing more people wearing the surgical face mask or the N95 masks as they walk around the city.
Afifa, thank you very much for that update. We've been speaking there to Afifa Arifin in Hong Kong. And to understand more about the Wuhan virus, we're joined in the studio by Dr. Piotr Chlebicki. He specializes in infectious diseases. Good evening, Doctor. Good to see you here this evening. All right, 9 people have already died in China. Were there any factors that were common about these 9 cases that we know? What do we know about the 9 who've passed on so far?
So far, the first few cases I could get some information about are typical patients who develop severe viral infection. These are middle-aged to elderly patients frequently with medical problems, who develop severe pulmonary infection, pneumonia, and who end up in intensive care unit. That's right now is the profile of the first few patients I could get some information about.
So the numbers are still low enough for us to consider. Would we see any difference in younger people? Do you think that they would be able to withstand this virus better, in a sense? Is there any indication of that?
Right. It's actually too early to tell. We all would like to know the profile of the patients who develop severe disease, and as the information flows in, we will know more about it, but as of today, it's really difficult to make such prediction.
Dr. Chlebicki, the virus, it's spreading. The regions that have it right now, U.S., Macau, Hong Kong, we have Japan, South Korea, Thailand. It's spreading at the rate that it is going. Are you surprised at the speed, or it's expected?
So there are two factors that we always take into account: how contagious is the virus and how severe disease it can cause. So it seems that the virus is fairly contagious, is spreading. Whether it causes severe disease in majority or in substantial proportion of patients, we don't know at this point. We have very limited information that is evolving day by day. I know that everybody would like to know everything, and now but simply we don't know enough to make such predictions.
And taking that into consideration, we've got the World Health Organization meeting in just a few hours from now to decide whether we've got an international public health emergency on our hands. What would that entail if they were to establish the need to say that? What would happen?
It allows WHO to focus more on this emergency. It allows to coordinate better the response among various countries. It allows them to share quickly information as and when it is generated. So it actually gives them some extra capability, although obviously they cannot dictate other countries what to do and how to handle it. They will be just better able to coordinate it and advise other countries how to handle this outbreak.
China today announced that the virus could be mutating and adapting. Can you help us understand what that means? Put it in context. What did they mean when they say that the virus is mutating and adapting?
So typically what happens, some viruses can effectively spread among animals. And in order for the virus to what we call jump species, something must have changed in the genome of the virus. And this change in the genome of the virus, allowing it to infect other species, humans, is called mutation. We think that that's what happened. Whether this virus is capable of mutating several times, again, that would be just a prediction. We don't know that part yet. Whatever mutation happened may be sufficient for this virus to spread among people, but we don't know that yet.
So with every mutation that happens, is it going to be more severe? Will it be more harmful?
No, viruses, in fact, mutate quite frequently, and most of these mutations are harmless. In fact, they are harmful for the virus. It's not good to undergo changes in their own genome. It may make it less transmissible too. We just don't know. The mutation that happened in Wuhan allowed this virus to infect humans, but whether subsequent mutations will make it more severe, most likely not, but we simply don't know yet.
And how alarming is it that we now know that, it can spread human to human?
Well, it definitely is a cause of concern. It definitely explains why we see these cases all over the world. We definitely have to have measured and calibrated response, because once we know more about how fast it spreads and how severe it is, I'm sure several countries and health systems around the world will be introducing gradually more measures to control this virus.
So, but what about individuals like ourselves, laymen? What can we do to protect ourselves? We're hearing you're wearing the mask, we're washing our hands often. Is that enough?
Well, these are very good starting common sense measures. And right now, as I mentioned, the response has to be calibrated. We cannot be too alarming and ask people to do a lot of things at one point. It will all depend on these two factors: how contagious it is and how severe disease does it cause. Obviously, we will introduce more measures as and when this virus reaches Singapore. Right now, we don't have any confirmed cases here, and we don't have any evidence that it's spreading in Singapore. So we will definitely monitor the situation, and I'm sure the hospitals, Ministry of Health monitors this situation, and we will introduce measures as and when required.
Yeah, so basic, good hygiene habits, still in place here. Thank you so much, Dr. Peter Chlebicki, an infectious disease specialist from Mount Alvernia Hospital, speaking to us here in Singapore.